Hello, welcome to Andrea's Corner. So tomorrow morning at 6:30, I have to go do a test called a PET CT scan. So I keep watching some videos trying to they explain it to me, but on YouTube I'm like trying to figure out, you hear, but I want to see it. So I guess when I get there, they're gonna have me change. Maybe they could let me stay in their clothes. I don't know. If it's a long sleeve, take it off. Then they're gonna have me lay on the table. Well, empty my bowels, all that stuff. Then they're gonna put in a needle and inject a fluid. I think it's like for the sugar level, the glucose level, something like that. Can't explain it properly, and after they put in this, I just write some stuff down. After they put in the thing. Okay, before that, so from tonight, I have to fast for 6 hours. So she said don't eat anything after midnight. So it's 8:12 p.m. right now. So don't eat anything after midnight. Fast for 6 hours. So when I get there, as I said, they put the IV in my hand. And I think they say I have to stay in the room for maybe half an hour or so. I can't move. How am I going to just lay down there and can't move? Because that messes up the scan. Well, that's just the injection. You stay there until that stuff go through your body. And then after that, then they still have to take you to another room, I think. Or maybe in the same room to do the actual scan. Probably in another room. Could be in the same room, I don't know. And that's going to be like it's different than an MRI. But it's like a machine that you go through. And you could come out on the other end. I just saw some videos. But an MRI machine have a back part where you can't go out. So it's different. So the stuff that they're going to inject into you is going to just make inside clear so you could see everything on the inside. So the scan is from like your head. It's going to scan your head down to, I think, your hip or your knee. Something like that. And you have to stay in the machine like about 30 to 40 minutes or so. Wait for 1 hour. It is scanned from head to toe, yes. I think after you put in this stuff, you have to wait for 1 hour before you do the actual test. After you put in the medicine. And then after the test, it's said to be careful for being around younger children because whatever is inside the stuff that they inject in you is not safe for you to be around young children after that test.
It's detailed pictures that allow doctors to see how the body is working inside. It can be used in cancer to see how active a tumor is. In this film, we will see what a PET CT scan is and how it may be used in cancer clinical trials. It shows an actor, Martin, going through the journey of having a PET CT scan, and we hear from a cancer patient about his experience of PET CT. This information applies to adults only, as there are important differences when PET CT is used in children. PET CT scans are used to take detailed pictures that show how cells in the body are working. The images are taken on a scanner like this.
Yes.
Firstly, the scanner takes a CT scan. CT stands for computerized tomography. This uses a low dose of X-rays to show where structures are located in the body. The CT scan takes about 30 seconds. This is followed by the PET scan, which takes about 20 to 30 minutes. PET stands for positron emission tomography. The PET scan shows...
Let me write that down. Positron. PET stands for positron. POSITRON. Positron emission tomography. Okay.
Extra information about how active cells about 20 to 30 minutes. PET stands for positron emission tomography. The PET scan shows extra information about how active cells are and whether they may be cancerous, as seen in this example of a lung tumor. In order for the PET scan to work, the patient is given an injection of a substance called a radiotracer about an hour before the scan. There are various types of radiotracers that can tell us different things about cancer, but the one most commonly used is called FDG. FDG is a sugar that has been modified to contain a small amount of radiation. Because cancer cells are very active, they take in more sugar than surrounding normal tissue. This means that when a patient is given an injection of FDG, it builds up in tumors, and the radiation shows up on the PET scan.
So you have to take that 1 hour before the scan.
The PET scan is then combined with the CT scan on the computer to allow doctors to see not only where the cancer is, but also how active it is.
PET CT is playing a major role in improving the care of our cancer patients. By participating in PET CT research, we are contributing directly to this. It will lead us closer to our goal of having personalized care for all our cancer patients.
There are 3 main ways that PET CT may be used in cancer research. It can be used to find out which patients are suitable to enter a particular trial. For example, for a lung cancer trial, a PET CT scan could be given to patients before they enter a study to get detailed information on the extent of their cancer. This information helps to make sure that the trial is an appropriate choice for a particular patient. It also means researchers know that they have a similar group of patients being studied, so they can be confident in the trial results. PET CT can also be used in clinical trials to find out whether a treatment is working. PET scans can show changes in the tumor earlier than other types of scan, sometimes as soon as 2 weeks after starting treatment. This means patients who are responding to a particular treatment can continue treatment. Patients who are not responding to treatment can be identified quickly and may need to change to another treatment option. Some trials look at new ways of using PET-CT to assess cancer. PET-CT scans already give us a lot of information, but researchers are always looking for ways to advance the way they're used. For example, a study might focus on assessing a new PET technique, finding out the best timing after treatment to give a scan, or comparing the information you get from PET scans against other types of scans. For a patient considering taking part in a clinical trial.
So that's can't play out the whole people day thing. I'm gonna go get my bed, call my name. Oh, so I could eat until midnight. Can't eat after that. So I don't eat it already. I don't think I'll be hungry. If I'm hungry, I have to get something in before midnight gets here. So if I try eat something, if I'm up 10 o'clock, 11 o'clock, but I'm munching something, but I can't eat anything after that. It's just 8:22 p.m. right now. I already eat dinner, so I'm gonna move from the living room to my bedroom. I have all my accoutrements to take up all my plugs to unplug. Let me turn off the TV. So after the PET-CT scan, I think next week, Thursday, I have to do a breast MRI. Can't remember how to do that either. I have to look up a video and try to remember. I know I did it before, but can't remember. Breast MRI. And after that now, then I go see the doctor at the hospital. So today I saw the lady at the clinic. She's the one who does this surgery. My cancer doctor at the hospital is a man. She went and she did that surgery this morning because she told me she had somebody a surgery to perform before she come and see me. So she said she went because she came in her casual clothes. She said she went and did a surgery. And she did cut off somebody's breast this morning. She did have a surgery performing a... It's a what do you call it there? You know, taking off the breast. I'll see if I'll come by for a few. But let me get off of this phone because it's saying I'm done, use up all my 3 minutes for the month, and it's gonna start cutting down my speed. I'm recording too much videos. Anyway, thanks for watching. Thank you for everybody who's sending in. Oh, I thought I ended this already. I was halfway in a damn sleep. Bye.